Leadership is often an overlooked quality of building sustainable and resilient healthcare systems. If you're familiar with WHO's 6 building blocks, a lot of people focus on the more tangible things, right? So how do we procure a hospital? How do we train more staff? How do we, import more medication? All of those things, the tangibles that you can see. But leadership is less intangible, but really cuts across all of those building blocks. So if you don't know how to manage your scarce resources, especially if you don't know how to manage various stakeholders, if you don't know how to manage competing priorities, how can you actually manage all of these things that are coming into your possession?
You're listening to Patterns and Meaning, a podcast by Seed Global Health. We find meaning in patterns, connect history to the present, and illuminate the way forward in global health. I am your host, Edem Tokunu. Today in the guest chair, we have Anuli Isichei. Anuli is a program manager and faculty member with the Healthcare Leadership Academy. At HLA, she designs curriculum and is also responsible for developing strategic partnerships. She's also an award-winning nurse. Prior to joining the HLA, she co-founded a global health initiative focused on providing comprehensive diabetes education to underserved communities. Welcome to Patterns and Meaning, Anuli. We're excited to have you on the show today.
Thank you so much. I'm really excited to be here as well.
Awesome. So let's get right into it. I'd like to ask you to share just a bit about your background and your experiences that have led up to you working with Healthcare Leadership Academy.
Sure. So I was born and raised in the U.S., actually in Long Island, New York. But my family is Nigerian, and growing up, my parents would always bring us to Nigeria every Christmas. So although I was abroad, I had somewhat of a connection. And after I finished nursing school, one of my close friends and I started a global health initiative. And on one of our missionary trips, we decided to come back to Nigeria. And we did a medical outreach at my grandparents' hospital in Enugu. And the experience was really, really phenomenal. We tested a lot of people, and a lot of people were really reached through that trip. And I think that kind of opened my eyes to opportunities to considering, at that time, I was still considering, could I actually work in Nigeria? Is it something that I can do? And then fast forward a few years later, when I was doing my master's program, I interned with the HLA, and kind of really the rest is history. 2017, I moved back full time, and that's how I ended up here.
Can you share a bit more about the initiative you started with your friend? Because it was had to do with type 2 diabetes, right?
One of my best friends and I, she's also a nurse. We started a global health initiative called Get Ahead, and we did a lot of stuff locally. We did like PSA service announcements, and what we were trying to do is to target the rise of type 2 diabetes in people under 25. So a lot of times you hear, type 2 diabetes for people that are, in their 50s and 60s. But it was really on the rise in the younger demographic, and we felt that it was a subset of the population that wasn't really being targeted. So we did a lot of things. Like I said, we put out several public service announcements that would air on our local television channels. We actually did a talk show style health segment that also aired in our local area. And then we worked with several mayors across the United States. So some in Maryland, some in New York, really to just bring awareness to the cause. And then in 2012, we decided to come back to Nigeria just to do a medical outreach. And the hospital at the time that we worked for, they were extremely supportive. They sent us with all of these medical supplies, blood glucose testing kits, alcohol wipes, gloves, everything that we needed. They even sent us with portable blood pressure cuffs, and we were able to test about 500 people during the medical outreach. And so it was really exciting for us, even as novices at the time, just seeing how much difference we could make. So I think that experience really just opened my eyes, one, to global health, and two, to all of the different avenues that nurses can actually work in. You don't only have to be a bedside nurse. And I think through that, and also through watching my grandmother, I don't know if I mentioned, but she is also a nurse, but she took some non-traditional paths. And I think that really just opened my eyes to all of the opportunities in nursing and midwifery, and of course in leadership as well.
You studied in the US, you're working in Nigeria now. You have experiences in both places. How do you think gender inequities actually impact the global health system?
Gender impacts, almost every aspect of global health care. When you think about it, the WHO says that women occupy about 70% of the global healthcare workforce, but only 25% of senior leadership roles. So that kind of goes back to, again, what we were saying, right? So women, are the providers, and they're the ones that are on the front lines, but yet they're not part of the decision-making table. And that's very concerning, because as we look at trying to achieve global health goals, such as the SDGs of 2030, how are we going to get there if there's so many persistent gender inequalities that are happening? And data shows that when women are in leadership positions, that there are more supportive structures that are in place. There's more collaboration. There's more teamwork. So really, there's a benefit to having women at the leadership table, especially in the global healthcare workforce. And I think that it's interesting because, this is not just a problem of the global South, right? But this also happens in the global North. And, I'll give some examples. So I'll use Nigeria as an example. When you think about women not necessarily being economically empowered or empowered socially to make certain decisions because of cultural expectations and norms, you have, for example, a woman that doesn't have any say in family planning, right? And we can see the impact that happens. And we also have, maybe, for example, a woman that cannot have an input in maybe the type of maternal health care that she wants. So all of those things, these are just two examples, but all of those things actually impact healthcare, actually impact the healthcare of women in particular. And it's something that needs to be critically addressed. And then, like I said, this is not something that's just unique to, lower and middle income countries, right? In the global North, you see this play out in different ways. You see it with the gender pay gap. You see it with the division of responsibilities in the home. So a lot of times the woman is not only outside working, but she's also tasked with, cleaning, taking care of the kids, helping them with their homework. And all of these things have an impact on healthcare. And so I think it's really, really important that if we're looking to achieve global health goals, that we begin to address some of the gender inequalities and not just think that this is something that is only related to one sector, but all of this has an impact on global health, in my opinion. I think the data actually supports that.
Yeah, and I think a change would start coming, especially if leadership starts to pay attention to these gaps and making sure that we start to close the gaps.
Exactly. And even just looking at, some of the cultural expectations and cultural norms, people have to begin to question them and challenge them. Why does it have to be this way? And I think because you really can't, if you think about advocating for policies to change, you have to start, in the home first. People have to actually buy into this theory that, okay, women are equal. We may not be the same, but we're equal and we deserve to have a voice in the things that are happening.
Anuli, so in what ways do colonial and neo-colonial influences continue to shape the narrative about African countries? And how does it hinder progress toward improving health for all?
This is it's an interesting discussion point, and it's really important that it's something that's brought up, especially in this part of the world. And so there is, I don't know if you're familiar with this, she's a renowned economist, Dambisa Moyo, and she has a book, Dead Aid, and I found it to be very, very interesting because there were a couple of topics she talked about how aid is actually hurting Africa. And I'm not going to say that I completely agree. I won't say that I completely disagree. What I will say is that she raised some very valid points. She talked about how aid kind of fosters inefficient policies, right? And doesn't allow people to critically examine and removing pressures rather from inefficient policies. She talked about how aid reduces accountability. And she also talked about how it's contributing to the brain drain. And I agree, right? When you always know that you can fall back on something and someone. Sometimes it does remove some of the responsibility from you. And I think also this whole notion of aid sometimes plays into the stereotype of, oh, those poor Africans, they really need help. The kids are starving. And it's like, what? I mean, there's a lot of wonderful things that are going on the continent. While we are not where we ought to be, there's a lot of talent that's coming from here. And it's not just from a healthcare perspective. So when you think about Ngozi Okonjo-Iweala, when you think about Chimamanda Adichie, when you think about even the Prime Minister of Namibia, who was hailed for her wonderful handling of COVID earlier on in the pandemic, there's so many wonderful things, and there's so many bright minds, and there's so many glimmers of light that are coming from here. And sometimes I feel that this whole aid situation doesn't necessarily give us a chance to showcase, some of the phenomenal work that we're actually doing. And I think that plays a bit into this whole imperialism. Let's just leave it at that. So I think it's a conversation that really needs to be had and continue to be had, because things are not as bad as they used to be, but things are not improving at the rate in which, was expected. And there's a lot of factors that play into that. This whole notion of aid, while it's good in some aspects, in other aspects, it needs to be reviewed. And that's really for us, as the sometimes recipients, really to just stand up and take accountability. So that's my perspective.
So then in your work at the Healthcare Leadership Academy, how are you, Anuli, and your team changing and challenging these norms that are already persisting to make work in Nigeria better, like the healthcare industry better for nurses and midwives and even recipients like myself? I mean, I'm not in Nigeria right now, I'm in Accra, but here I'm a recipient of healthcare. And so what work are you doing to challenge these norms and make things better for us all?
And that's a great question. And I love to talk about what the Healthcare Leadership Academy does anytime I get the opportunity. So thank you for that. So basically, the Healthcare Leadership Academy, I'll just give you a brief background, is a Nigeria-based social enterprise that offers integrated leadership management and quality improvement programs. And essentially what our vision is to develop the next generation of leaders that excel in the governance and the provision of services. And so the reason why, as an organization, that we focused on leadership is because leadership is often an overlooked quality of building sustainable and resilient healthcare systems. And if you're familiar with WHO's 6 building blocks, a lot of people focus on the more tangible things, right? So how do we procure a hospital? How do we train more staff? How do we, import more medication? All of those things, the tangibles that you can see. But leadership is less intangible, but really cuts across all of those building blocks. So if you don't know how to manage your scarce resources, especially if you don't know how to manage various stakeholders, if you don't know how to manage competing priorities, how can you actually manage all of these things that are coming into your possession? And so the Healthcare Leadership Academy really focuses on building up critical leadership and management skills so that we can meet our health goals and have more resilient healthcare systems. And essentially the way that we do that is we provide highly contextualized folk training programs. And I think that's really, really important because a lot of times you see organizations that are coming, let's just use the West, that are coming from the West and very prescriptive. We know what your issue is, and this is what we're going to do. And it's like, no, no, no. Our landscape is very, very different, and it's not a one size fits all kind of thing. And so the reason why the Healthcare Leadership Academy is really unique and really successful in the work that they do is that everything is specifically tailored. We have an intimate knowledge of what's happening in the sub-Saharan African healthcare space, especially in Nigeria. You know, we've worked with several governments, several governing bodies, several state governments. We've worked across several countries within Africa. And so we have an intimate knowledge of what's happening on ground. And so while we do partner with global thought leaders and respective institutions, we are at the forefront of developing a lot of our curriculum and developing our training programs so that, like I said, it's context specific, which is key. And I think maybe back to your original question about what's happening in, I'll even just use the Nigerian healthcare space as far as leadership goes. It's very interesting because Nigeria puts out, you know, some of the best and brightest minds that work abroad, right, in the healthcare space, you know, doctors, nurses, whomever. And it's interesting. You say, oh, wow, they're doing so well abroad. But here, you know, the healthcare performance is suboptimal, to say the least. And, you know, there's a myriad of reasons for that, you know, poor infrastructure, you know, lack of political will, but we won't really get into that. What I'll look at it is from the leadership standpoint. And a lot of times people are thrust into leadership positions, maybe because, okay, you've been a nurse for 25 years or a doctor for 25 years, and you've performed well clinically. I think you can manage or run, or I think I can start my own hospital. When it's not really like that, right? You may have really good clinical skills, but that doesn't necessarily mean that you have the requisite skills to successfully manage an institution and to provide quality services. So that's a lot of what you're seeing is happening on ground. And what the HLA is trying to do is to close that gap and build capacity with healthcare providers, you know, across the continent.
You touched on something that I want to explore some more, which is that sometimes you'd see organizations come from the West with issues already spelled out and prescriptions to those issues spelled out as well. And this is without consultation with the country that they're going into. And it's actually something that other guests on the podcast have touched on. So in your work with the Nigerian organizations that have partners from the West, how do you advise them to create partnerships that challenge this way of working, especially when it comes to funding?
It's really, really important if you're going to be receiving funding from an outside source. You are the expert on you and what's happening in your community and in your home and whatever it is, right? So now when we think about an organization wide, you are the expert. You know, and this outsider that's coming in, they may have done all of the desk research. They may have spoken to 1,000 people, but you know the nuances and you know exactly what your community needs. Now, they may have the funding and they may contribute to other aspects, but I think that your voice should definitely be heard, you know, and you have to advocate for what you feel is best. So if, you know, a funder wants to offer you, you know, $1 million to cure river blindness in your community, but river blindness is not an issue and your real issue is non-communicable diseases, you need to speak up, you know, and so either maybe that means foregoing that funding, or that means maybe let's have a discussion. How can we change this opportunity so that's mutually beneficial? But you don't want to be in a position where the funder dictates everything that's happening on ground, because at least to a very concerning position, if you ask me. And it means that, one, there's an unequal power dynamic, which I think in this day and age of, you know, receiving aid, it's something that needs to be critically looked at. And maybe that's a topic for another time. But I think it's really, really important that there's more collaboration, that the people on ground have the autonomy and have the ability to speak up and say, no, this is what we need. And I think that would be really a step in the right direction of kind of better managing these partnership situations, in my personal opinion.
Piggybacking on that, I'm referring to conversations with other podcast guests, but one thing that's come up is that a pandemic like COVID-19 has actually shown this, because in this time, or in this season that we are in, basically each country is suffering and everybody has to fend for themselves. And so the country that may have supported you needs to support its own self and its own people. And so right now it's causing us to, or it's getting us to rethink a lot of things, especially when it comes to healthcare in particular, and funding and the models we've had for projects and all those things.
Yes, that's a really, really good point that you've raised. Just like you said, there's so many things that are happening, right? Like you said, early on in the pandemic, if you remember, getting personal protective equipment was nearly impossible. And it now we actually had a webinar about this, it now made people to start thinking, how can we produce this here, right? We don't have to be, we have the skills, we have some of the infrastructure to do these things. Why are we so dependent on outsiders to actually help us? So it causes you to be more resourceful. And I think, just like you said, that goes back to this whole aid notion. If you don't have this crutch, you're either going to sink or swim. And most people don't want to sink. So, it causes you to be a bit more critical, and to think about, the in-house resources that you do have, which is important. So, nobody wants to get to a disaster where you have to start thinking about that, but we have to get to a point where we have to say enough is enough and we want better. And I think we're getting there, but it really has to be the collective political will that really backs this.
That's a great segue. So in your work in Nigeria and with other African countries, how has working with governments been like? And how do you think healthcare institutions can better position themselves to work with government?
What's really, really important is going back into understanding what that government's needs are, right? And you don't want to be, even though you could be, within the continent or even within the country, right? You don't want to be that organization that comes and is prescriptive based on what I think, this is what you guys need help with, when in actuality, that may not be even their concern, right? So I think it's really, really important when you're working with governments is to understand really what their needs are, how you can critically address them, and also be prepared. There's a lot of bureaucracy in government, so things don't move as quickly. Things are not as straightforward as you think that they will be. So it's to be prepared that you may be frustrated at times, and also to know that everyone that may do and participate in your programs may not have. They may be doing it for completely different reasons, right? So my local government has nominated me to participate in this leadership and management program. And so while my local government wants to see me build up those skills, when I participate in the program, I maybe get a per diem and all those things. So there may be other external factors that play into why people may participate, and which can actually frustrate someone, a faculty member or somebody that's training, because you're wondering why they're not as engaged or they don't seem as invested, and there's other alternative issues at play. So I think it's just to always keep in mind that sometimes everything is not as straightforward as it is, and really to understand the needs of that specific government. It would be, I think, some of the key things, in pursuing some of those partnerships.
How can we create more equitable partnerships in global health?
I think that it's really, really important that co-creation happens. It's not this, I know best, you guys do this, right? But there's a balance of power there, right? So each person's perspective is respectfully considered, And, everybody brings ideas to the table, and then we do, we have partnerships that are mutually beneficial. I also think that it's really important to begin to empower, low and middle income countries to put out more research, to write more, to really have their voices and, their voice is heard in the global sphere, right? So it's not just the West or the global North, for example, that houses all the knowledge and that is the experts on everything. That's not the case. And I think that if we want more equitable partnerships, we have to begin to see how we can co-create. I think communication is also a really, really big part of that. So we spoke a little bit about, being able to advocate for what you feel is best for your community, your organization, whatever it is. And that has to go with communication, right? So the lines of communication have to be open. You have to be willing to receive, partners have to be willing to hear and receive what their fellow partners are saying. And I think another key point is sustainability. So what I think you don't want to happen in a partnership is that for the 5-year partnership, we've done all this great work. And then as soon as the partner pulls out, everything falls to pieces, right? So there needs to be sustainability plans. How do we continue? How do we keep this learning going? How do we cascade the knowledge? How do we make sure that the organization or the community or whatever it is continues to grow even in our absence? And I think that is really, really key if we want to see more equitable partnerships, because one day we hope that, the partners that were on the receiving end at one time can now go ahead and build skills and build capacity, for another institution, another organization, another country. And the only way that they can do that is, building capacity, putting accountability measures in place, and really just being clear from the onset, everyone, what is it that we want to achieve and how will we go about doing that? I'm sure there's so many different ways to do that, but from what I can think of, those would probably be some of the ways that you can consider as we try to make partnerships more equitable, especially in this part of the world.
And right now in your work with the Healthcare Leadership Academy, you also do some work with the Nursing and Midwifery Council in Nigeria. So when you look at your work, what that you did with the initiative and what you're doing with the council right now, how do you think, even looking at your grandma's experience, what do you think is the role of associations like the council in building the capacity of nurses and midwives?
So like you said, the Healthcare Leadership Academy does do some work with the Nursing and Midwifery Council, just in the respect of that they certify our program. So they make sure that they fit under certain guidelines, and the nurses that do take our programs can get continuing education or continuous professional development points, which they need to maintain their license. So I think the role of a regulatory body such as the Nursing and Midwifery Council of Nigeria is really to support the advancement of nurses, right? So to give them, open their eyes to opportunities. I think professional development is something that's really, really, really critical in nursing and in every healthcare profession, to be honest with you, but especially nursing in a place like Nigeria where medicine is practiced in a very patriarchal manner. And so when I say that, I mean that the doctor is always right. And the nurse, although she spends most time with the patient, she's to be seen and not heard. And it's really important that you empower nurses to be able to speak up, to advocate for the right policies, to occupy leadership positions, and like you said, to be change agents. And the role of the Nursing and Midwifery Council in doing that is really to open their eyes and provide opportunities for nurses to be able to do that. And I think they're doing a good job in really supporting and bolstering the nursing and midwifery profession.
We know that nurses and midwives are crucial to achieving universal health coverage. And last year was actually the year of the nurse and midwives. So you, Anuli, if you were given all the resources that you need, what investments would you prioritize for this workforce?
Oh, another subject that's near and dear to me. So I think it's important to note that, I was so happy in 2020 when it was the year of the nurse midwife, because nurses make up half of the global healthcare workforce, half, So they're the ones that are on the front lines. They're the ones that intimately know the patient. And I think it's really, really important to, again, build up their skills, put them in positions of leadership, put them in places where they can advocate. And if I had unlimited resources, training and skills building would be one of the things I'd focus on. And when I say training, I mean leadership and management training, equipping them to be at the decision-making table in leadership positions, to be able to effectively advocate for policies that could change and improve community healthcare, to sit on boards, to sit, in leadership positions within their organizations, and even to take political offices. I think that's really, really important. We've talked about political will and how that is key really in achieving some of the health goals. And you need an advocate there that intimately understands the needs of the population and is also well trusted. And so you need nurses in that position to really successfully advocate for their communities and their patients. And I think, as I spoke about earlier before, nurses in many parts of the world are not empowered. They're to be seen and not heard. And if we want to achieve all of these lofty goals that we have, we really need to empower them to do more, to speak up more, for their voices to be heard. So I was thrilled to see the year of the nurse midwife in 2020. And it shouldn't just stop in 2020. Every year should be the year of the nurse midwife. So if it was up to me, definitely building up their leadership and management skills would be a key priority area for me.
So whilst you were talking, you mentioned Dambisa Moyo's book, Dead Aid. Are there any other books, maybe webinars or podcasts or resources that you think would be good in getting us to think around this topic of colonizing global health?
So first of all, I have to do a shameless plug. And I have to say that HLA, the Healthcare Leadership Academy, also known as the HLA, we offer a monthly webinar series. We actually offer 2 monthly webinar series, Ask the Expert, and then our regular monthly webinar series. And I think it's really, really key because what we do is we showcase the talent that's happening here. And, we touch on everything from relevant topics to the brain drain. There's so many different things that we plan on touching on this year. And so I think it's really, really important to support homegrown institutions or indigenous institutions rather, that are doing that and, are shedding some light on what's going on and getting the perspective and learning what your fellow colleagues are doing, what's working, what isn't working. So, yes, it's a shameless plug, but please check out HLA's website, www.hlaafrica.org, to find out more about our webinars and different learning resources. As far as other books go, so I'm a huge, huge LinkedIn person, and I always find that there's so many interesting articles, so many, even just blog posts and just interesting perspectives that you can find on there. So I would recommend that. Again, the Dead Aid book, I think, is fantastic. I believe Jeffrey Sachs as well also talks a bit about, the trouble with aid, so that he may be another good person to check out. But yeah, definitely checking out what's happening on ground, maybe through webinars, like you said, through podcasts, through LinkedIn, through social media. Social media is fantastic if you just want to know quickly what's happening. So I definitely think utilizing all of those resources would be helpful. And then podcasts like this. So it's really, really important. What T Global is doing, about really just again, showcasing the voices global voices that are, around and that are speaking about relevant issues. I think that's really, really important. And giving people a platform, I think, is key to be able to share their perspective, and hearing different perspectives. Maybe my perspective and your perspective aren't the same, but that doesn't mean that both aren't right, or that doesn't mean that both can't be married, and we can find a mutual solution. So I say just be open, and look for the various resources that are around.
This is a great note to end on. Thank you so much for being our guest, Anuli. It's been such a pleasure speaking with you. It's been very insightful, and there's so many resources that we're going to put the books and things that you've mentioned in the show notes, so that if anybody wants to check them out, they would be able to check them out.
Awesome. Edom, thank you so much. I really enjoyed this conversation. Thank you for having me, and great work to Seed Global for all the fantastic things that your team is doing. Well done.
That was an insightful and fantastic conversation with Anuli. My key takeaway is that nurses make up half of the global health workforce, and so it's important to equip them with leadership skills that allows them to be in key management positions so that they can advocate for policies that can improve community healthcare. And both Judy Kanyola and Tembi Mukori, who have been guests on the show, have mentioned this during their episodes. For me, it just shows how crucial this is. If you have missed the earlier episodes of the podcast, I'll encourage that you catch up on them. You can listen on Google Podcasts, Apple Podcasts, as well as Spotify. We've had really, really great, thought-provoking conversations with some of the best nurses and midwives on the continent.